Hello everyone. Here we have a case of spinal epidural abscess due to Streptococcus bovis associated with benign colonic hyperplastic polyps. Spinal epidural abscess is an uncommon but important infection of the CNS system with a 15 to 16% mortality rate. The incidence of SEA has been increasing in recent years, attributed to the widespread use of invasive spinal procedures in aging population, immunocompromised population, and a rise in IV drug use. The most common pathogen being Staphylococcus aureus. On rare occasions, no particular pathogen can be identified. Here we present a case of SEA associated with Streptococcus bovis in the setting of a benign colonic lesion. Strep bovis is commonly associated with colorectal malignant and premalignant lesions. To the best of our knowledge, no single case of Strep bovis associated SEA in the setting of a benign GI tract lesion has been previously reported. We had a 79-year-old Hispanic woman who was transferred to our institution because of moderate back pain associated with fevers and chills ongoing for 3 weeks. She had a past medical history of type 2 diabetes and hypertension. She denied recent or remote spinal epidural injections or invasive spinal procedures and no history of IV drug use. On physical exam, she had a temperature of 37.7 degrees, slightly tachy, normotensive. Heart exam was normal. She did have midline lumbosacral and left-sided paraspinal region tenderness. Neuro exam was normal. She had a leukocytosis of 14.18 with neutrophilic predominance, a CRP of 8 and ESR of 99, and the rest of the labs are normal. She was started on broad-spectrum IV antibiotics, which was then transitioned to IV ceftriaxone when cultures grew Streptococcus bovis. MRI of the spine showed arachnoiditis with ligament enhancement from L3 to S1 and early signs of epidural abscess. She had a CT-guided sacral epidural abscess decompression and cultures done. TTE and TEE did not reveal any evidence of endocarditis. Colonoscopy showed a 2 millimeter polyp in the ascending colon, which was biopsied. That biopsy showed hyperplastic mucosa without any malignancy or dysplasia. She was treated with a 6-week course of IV ceftriaxone and recovered. That right there is the hyperplastic polyp in the ascending colon. Spinal epidural abscess is an uncommon clinical condition with an average incidence of 5.1 cases per 10,000 admissions in the U.S., usually spread hematogenously. The most common pathogen being Staph aureus in almost 70% of cases. Here we presented a case of SEA caused by an unusual agent, that being Strep bovis, which is usually found in 2.5% to 15% of normal individuals' GI tracts. Strep bovis is a gram-positive non-pterococcal Streptococcus bacterium that belongs to the Lancefield group D. Commonly causes infections such as bacteremia, septicemia, endocarditis, less frequently endophthalmitis, soft tissue infections, and septic arthritis. It's usually associated with colorectal malignancy and premalignant lesions. Some studies have reported a weak association of Strep bovis bacteremia and benign colorectal polyps. It's not well known whether the association was true or had happened by chance. The relationship between Strep bovis and colorectal neoplasia has been known since 1974. The pathogenesis of Strep bovis bacteremia and its association with colonic disease has been researched in several studies. No exact pathogenesis is known. It's thought that the ulceration of neoplastic lesions would be the pathway of bacteria to enter the bloodstream. However, this hypothesis does not explain the case of association between Strep bovis and non-ulcerated benign or malignant colonic lesions. In our case, we believe that Strep bovis had most likely hematogenously spread from the GI tract, considering the hyperplastic polyp that was found during the colonoscopy. The presence of a hyperplastic polyp has been associated with Strep bovis bacteremia. So our case emphasizes that SEA can also originate from benign colonic lesions. Thus, it's essential to have surveillance of the GI tract to diagnose malignant, premalignant, or benign colorectal lesions in patients with Strep bovis bacteremia associated spinal epidural abscess. These are our references. Thank you.